So the picture was of mauves and pinks and purples, and it was a picture that was on the wall. And there were 3 columns, and there were 2 spaces in between the columns, and I stared at this picture. And the grass was very green, and it was very beautiful. I was 15. I stared at this picture for weeks, maybe even months, with my arms crossed, before I decided to talk to my therapist. Her name was Augusta, and I have no idea what she did to help me, but I knew that she let me bring my friends with me to therapy, and that was fun. And I didn't really understand the connection between that and therapy being fun until I wrote this speech today. So almost 30 years later, as adults and adolescents stare at the pictures on my walls, I hope that I have the same compassion, patience, respect, understanding, and fun that my therapist had for me. What I can tell you is that 20 years later as a psychotherapist, and a mother, and a wife, I'm on my 2nd time around, and a friend, and a daughter, and a sister, is that therapy can be fun. It can actually be a place that you enjoy going to. All right, so I do yoga. I don't know if anyone else here does yoga too. Yeah, oh yeah, I got a little feedback. Yoga is super hard, and it's great for the active thinker. So I'm in class a couple of weeks ago, and I'm having a great class. I'm doing my vinyasas, I'm doing my tree pose, let me see if I can do that, and my eagle pose, I better be careful, right? And I'm doing my downward dogs, and I'm centered, man, I'm having a great class. And we're laying on our backs, and we're rounding the bend, and I'm thinking, what a great class this is, and knees to chest, and what happened? I farted. And it was loud, and I was embarrassed. And you're thinking, why the hell is this woman telling me this story? I'm telling you the story because if I ever had a client that was embarrassed or humiliated about something, would I share this story with them? Absolutely. Because I'm here to tell you, let me confess, therapists are humans too. We have good days and bad days, and definitely, honey, have fat days. So, we're going to have a little fun today. Everyone ready to have a little fun? Okay, I'm going to give you 3 nuggets, 3 golden nuggets of information. I'm going to give you 2 really fast and furious, and 1 you're going to have to wait until the end. But I want to talk about laughter. What's so great about laughter? Laughter is fun, and it's free, and it's healthy. If I can make one person smile each day, I've had a really, really good day. But you know what's not so great? Guilt. Now I'm not talking about the guilt that when you feel bad, you feel remorseful. You know, the good thing about that guilt is when you do something and you feel bad, you feel remorseful, you know you're not a sociopath. So that's good, we like that. I'm talking about the guilt that you wear like a big heavy blanket to the movies, or to the nail salon, or when you go on vacation, and you think, God, why do I have this guilt? It's preventing me from having a good time, and I'm here to say, stop asking yourself why. Who cares why? Tell guilt to go out and play in the rain, or better yet, give guilt the finger. That's your golden nugget number 1. Okay, everyone got their golden nugget? Okay, golden nugget number 2. Stop asking yourself why. Abolish that word from the dictionary for yourself, please. Why is like running on a hamster wheel. Because even if you figure out the why of something, which you may spend days, weeks, months, years, decades, centuries trying to figure out the why of something, I'm going to challenge you and say, how is that helpful for you? Right? That's golden nugget number 2. So what is therapy exactly? It's like being on a date with yourself, only without the wine. And you think, it doesn't sound like so much fun, Allyson, being on a date without wine, no less. But the more that you get to know yourself, and the more that you get to know this other date, the better it is, and the more interesting it is. And the more you can laugh with yourself, at yourself, and have perspective, you get the gist, the better it is, and the more fun it is. You know, Mark Twain said it best, before the assault of laughter, nothing can stand. Let's see, therapists, I love them. But you know what? One thing about them is that they do not like to be transparent. They don't like to tell you what's going on. I say pull back the curtain. Tell the clients what's going on, because therapy is a lot more fun when you know what's going on. Yes? I'm not so sure that there are any actual fun techniques in psychotherapy, but SolutionFocused is how I roll. Now, Solution Focus was created back in the 80s by the folks in Milwaukee and Sue Kimberg and DeShazer and Scott Miller. And what I love so much about it is that it focuses on the present and the future. Yes, we learn about your past, we want to know, we want to be empathic to things that you've gone through, but it's all about where do you want to be and how are we going to get there. So there are three, let me back up. It is not, let me tell you what Solution Focus is not. It is not psychoanalysis. Okay, I'm not going to sit behind you smoking a cigarette 5 days a week. Yes, they went 5 days a week, deconstructing your life, asking you how you feel, and asking you why you feel that way. And analyze this, analyze that. In the end, everybody blames their mother anyway. There are three types of clients in Solution Focus. And we identify these clients so we can assess their motivation for change. The first kind of client is a visitor. Now, a visitor is not interested, they're not shopping for therapy. They've been mandated by a judge, an organization, maybe their doctor, possibly their wife. And so take a pottery shop. And they walk into a pottery shop and the salesperson says, "Hello, can I help you?" And he says, "No, thank you, I'm not shopping. My wife just asked me to come in to look at this." And he walks out and doesn't purchase anything. That's a visitor. The second kind of client in Solution Focus is called a complainant. Now, a complainant is an interesting kind of chap, because a complainant is suffering emotionally, but he does not see himself or herself as part of the conflict or the solution. So let's take that same pottery shop. So he walks into the pottery shop and she says, "Hello, may I help you?" And he says, "Yes, you may, absolutely. Can you take down that piece?" And she says, "Yes, let me take it down, that's too big. That piece, let me take it down, no, that's got a chip in it. No, that piece, no, it's too blue." So they look like they're shopping for the service, but they're not really interested in purchasing anything. That's a complainant. The third type of client is a customer. Customers are great. We all love customers because they're shopping. They're suffering, they see themselves as part of the conflict and the solution. So you have that same pottery shop and she says, "Hello, may I help you?" And he says, "Absolutely. I'm going to take that piece, wrap it up, here's my credit card, have a great day." You see, here's the thing. Why is this so important? We look at clients' motivation for change because you can become a customer from a visitor. What's cool about Solution Focus and identifying and assessing clients' motivation for change is because it can move at any given time. So you can walk in a visitor and leave as a customer. Clients are highly articulate about what they do not want in therapy, but they're equally reticent to talk about what they do want. Well, I want to know what you want. I want to know what kinds of behaviors you are willing to engage in the therapeutic setting. Now that's Solution Focus work. So I have a secret. I'm going to share a secret with you. Lip service in therapy is a waste of time. Mostly your time. So say what you mean and mean what you say, because therapy might be more enjoyable that way. One of my favorite questions in therapy is, what is your best hope? What is your best hope? Well, I'll tell you my best hope. My best hope is to weigh 110 pounds and to have a six-pack and to be really fit. But here's the deal. I'm a complainant in this issue. I'm a complainant because I'm really not willing to engage in the behaviors that will get me there, because I would rather live my life at the bottom of a McDonald's French fry box than eat carrot sticks every day. So it's very easy in therapy, again, to focus on the things that aren't going right. But in solution-focused therapy, what we do is this. We bust out the telescope and look for exceptions. When were times when you were doing things right? Was there ever a time that you were competent at being, say, a healthier person? You know why competence is good? Because it's fun. We like to be competent. So solution focus is all about looking for what's working in the right direction, what's worked in the past, and how competent you are. All right. So I am socially intelligent. I have what's called the gift of gab. And according to Martin Seligman, the founder of positive psychology, I have taken my greatest strength, the gift of gab, and I've recrafted it into the work that I do. So that means that I have taken my gift of gab and recrafted it into being a therapist who can be relatable to clients. See, people say to me all the time, "Why are you so happy? You're so happy." Well, I'm not happy all the time. Ask my kids, they'll tell you that I'm not happy all the time. That's a load of honky-tonk. Nobody's happy all the time, but this is what I do know. I get to serve the greater good, and I love that. I also know that I'm stuck with myself. And you're stuck with yourself. One of the things that I know is that we can't unzip our skin and pop right out of there. So since we know that we're stuck with ourselves, when was the last time that you said, hey self, I love you. I really, really do. So in the spirit of positive psychology, I ask you to think about, what do you feel passionate about? What are your highest strengths? All right, I love this one. Decades of scientific research indicate that the relationship between the client and the therapist is the reason why clients improve or fail to improve, just as importantly as the technique that is used. Whoa! So that's saying that being relatable to clients and the relationship with clients is just as important as the techniques that you use with them. That is mind-boggling to me, and that's why it is so important in the therapeutic sessions to be real and to be human for clients. Yes, we do. We talk about shoes and new haircuts and vacations. My office is adorned with pictures of kids, my kids, other people's kids, clients with their permission, of course, and we have a dialogue about these things. You think self-disclosure is okay in a thoughtful and intentional way, and for a therapist to have clear boundaries and understanding their needs, then they can self-disclose. Now let me be clear. This is not about me being friends with my clients. I have my own friends. My clients have their own friends. But this is about having a professional therapeutic relationship with a client where they can relate to you as a human being. You see, here's the deal. You come to me and you tell me all of your deepest, darkest secrets. You tell me all of these personal things about yourself, and I'm not supposed to tell you anything, like where I went on vacation last month when I was out for 3 weeks. I don't think that that's fair. Now, I know your mother always says life's not fair, so, we'll go with that. But according to traditional therapeutic practices, I'm not supposed to tell you a thing about my life. I don't think that that's therapeutic, because you look at me and view me as the expert on your life, and I'm here to tell you, as a solution-focused therapist, I am not the expert in your life. You are the expert in your life, and it's my job to teach you that. Positive communication celebrates dignity. I love this quote. It's such a beautiful quote. Please don't ask me who said it, where it came from, because I have no idea. But what I can tell you is the ultimate sign of civility and respect is to respect a client's right to self-determination. And you're probably thinking, what the heck is she talking about? I'm going to tell you what I'm talking about. It means that in therapy, your therapist should be following your agenda, not their agenda. Okay, ready for the last golden nugget? All right, here we go. It's about compliments. Now, I want to know, and this is a lot for, it might apply to some gentlemen in the room, but it's definitely going to apply to my ladies in the room. What happens when someone compliments? They say, oh, you look so pretty today. You say, oh, it's the dress. It's because I'm wearing black. It's because I got a new hairdo. It's like that compliment is trying to jam its way into this tiny, tiny little hole, kind of like a hole-in-one, and it just can't get in there and stick. But when someone criticizes you, man, it's like a big, giant, gaping, gargantuan sinkhole, and that criticism gets in there and sticks in there and stays in there forever. So I'm going to say to you, what has to happen for you to accept a compliment? You didn't see me say to you, why don't you accept the compliment, right? I didn't say, how do you feel about not accepting the compliment? So when someone compliments you, what can you say? Thank you. Should we try it again? When someone compliments you, what can you say? Thank you. You got it. So listen, when you're shopping for a psychotherapist, find one who's educated. Find one who's got good credentials, and find one that you can relate to and have a good laugh with. Check out solution-focused therapies, because that is where we're headed. The techniques have been proven worldwide, and the future of therapy will be completely strengths-based. And remember your golden nuggets, folks. Give guilt the finger. Why ask why? And when someone compliments you, say thank you.